This PowerPoint will focus on the adult and child prophy. Appointment length. An adult prophy is typically scheduled in a hygiene column for 1 hour. A child prophy is typically scheduled in a hygiene column for 30 minutes. It is very important to review your patient's charts before the day of the appointment. So review your patient column the day prior to the appointment. Some things we want you to look for. Is health history up to date? We want this updated yearly. In regards to the health history, does anything warrant pre-med? Is there a history of pre-med? Are there special needs? Allergies? Is there outstanding treatment this patient may have within their chart? Does the patient have a full mouth probe on file? And if so, do we need to update it? We want this updated at least 1 time per year for your normal prophy patients. And this is on adults 18 years and older. 18 years and older, they must have a full mouth probe documented within their chart. Are they due for radiographs? Typically, we take 4 bite wings 1 time per year and a full mouth series at least updated every 5 years. Continuing with reviewing your patient charts, are there any unscheduled family members? Read through the past note history. Read through the most recent note and maybe a couple after that. Be aware of their past appointments and any special treatment they may need. And then, is the patient eligible for an adult fluoride treatment? Have they done it in the past? And would insurance cover it if we did it today? Preparation is key. The more you know, the smoother your appointment will go. Review your charts and be ready to see those patients the following day. Your patient arrives. The goal is to get them seated promptly. Your office has a hate to wait policy. And what this policy states is that for every minute a patient waits after 10 minutes, our dental hate to wait policy pays them $1. We don't want to make patients wait. We want to let them know that we understand their time is valuable. So an example of this situation might be, your patient's appointment time was 1 o'clock and the patient was seated at 1:20. We owe that patient $10. We make the patient aware of that and let them know, Lisa, we do not like to make our patients wait, and because of that, we are going to put a $10 credit on your account today. Always uphold yourself with an array of positivity and confidence. The way you present yourself to the patient gives them the comfort they need throughout the appointment. Some examples might just be, greet them with a smile. Use a positive and upbeat tone. Maintain eye-to-eye contact. Be personable and be confident. We next seat the patient. Most important thing, as with any appointment, are there any changes in your health I should be aware of? Ask the patient this. And if the patient's a child, ask the parent or guardian. Are there any changes in your child's health that I should be aware of? Also, another great introductory question to ask is, are you having any pain or problems at this time? Or if it's a child, is your child having any pain or problems at this time? Once the main 2 introductory questions are addressed, continue with treatment. Evaluate the past and present radiographs. Complete a full mouth probe if the patient is due. Usually we just do 18 and older. Evaluate and explain to the patient what you're doing and why you're doing it. Every tooth must have probing depths associated with it and recorded. We do not spot probe. We use the 6-point probing on every tooth. All depths must be charted, not just depths of 4+. We record bleeding, recession, furcation involvement, and mobility. This all must be charted. Every patient must have a full mouth probe on file. With normal adult prophy patients, we want them updated at least 1 time per year. I'm showing you an example of a full mouth probe done correctly. As you can see, every tooth has points associated with it, and it is recorded on every single tooth. This is an example of a full mouth probe done incorrectly. This is what we would consider a spot probe or an inadequate probe. You will note there are not points recorded for every tooth in that dentition, and there are only localized points recorded of 4 millimeters or above. This is done incorrectly. Continuing with treatment. Probing is done. We're going to perform the adult or child prophy. We're going to use the instruments we need, whether we need a hand scale or cavitron. We're going to polish, we're going to floss, and we're going to use fluoride varnish if we can, and if the patient gives us their consent. If it's a child, make sure to receive consent by the parent or guardian. Continuing with treatment, we truly believe in intraoral pictures. Some examples of intraoral pictures you could take on your patient are maybe before or after supracalculus removal, areas of concern, so maybe an area of a bleeding amalgam, a fractured tooth, a tooth that might be fractured down to the gum line. Anything that you see would be worthwhile taking a picture of, and a patient might like to see themselves. We want to show the images to the patient and discuss. So for example, we cannot diagnose, but what we can do is make the patient aware. So we could say, Mrs. Jones, here are some suspicious areas I have noticed and would like doctor to take a look at when he comes in for the exam. I just want to give you a heads up before he arrives, and from here he will make the diagnosis. Another key term we could use is, Mrs. Jones, these are some areas of concern I have. I will make the doctor aware and he will address these when he comes in. We will then formulate a treatment plan accordingly. Next, we want to make sure we're completing our oral cancer screening, whether it's just the hygienist doing it or the doctor doing it or a combination of both. Sometimes 2 eyes is better than 1. Create a team. And then patient education. Use whatever materials you have accessible to you, whether it be intraoral pictures, handouts you may have accumulated, videos you want to show. Education is key. Here are some examples of intraoral pictures that were taken by a hygienist. This patient presented for a 6-month recall, tobacco user, and does not like the stain she accumulates. She's wondering if there's any way that you can just get it off for me. The hygienist took the before and after intraoral picture to show her the results using the cavitron and hand instrumentation. The patient was in awe, couldn't believe that this stain that had been bothering her for so long was easily removed. This is a picture of the lower anterior lingual. Another picture, same patient, tobacco user and didn't like the stain she accumulated. And she just did not like to smile because it would show up when she smiled. Again, wondering if there's a way to get it off. This is a before and after picture of the results after using the cavitron and hand instrumentation by the hygienist. This is the lower anterior facial. Notice the difference. This patient will definitely want to smile now. Another example, lower anterior calculus removal. Patient presents, really doesn't notice the fuzziness or the calculus deposit. The hygienist begins to clean, gets it all off, and shows the patient the after picture. The patient is in awe. Is that really what was behind my teeth? Some patients don't realize what's going on, and a picture, again, shows the difference and shows what we did for them during that appointment. So a lot of times we let the doctor know we're ready for an exam, and sometimes there's a wait because the doctor may be busy. So we want to make sure that we're making the most use out of our time. What can we be doing while we're waiting for that exam? Schedule the next recall for the patient. So the correct way to go about this is by saying, Mrs. Jones, your next appointment will be due in August. Let's take a look at the schedule. What day and time works best for you? The incorrect way would be, Mrs. Jones, do you want to schedule for your next recall? Because this answer is either going to be a yes or a no. And if it is a no, there's really no place for you to go from there. You want to leave your question open-ended. You don't want it to be a final answer of yes or no. Look at the schedule. Mrs. Jones, this is when I can get you in. Now just tell me a day that works best for you. Let's reserve this appointment time for you. And then if it gets closer, we can always reschedule it or put it at a different day. But this will ensure this time and day for you. We're going to dispense the complimentary take-home kit, so we can do that while waiting for an exam. The toothbrush, the floss, the toothpaste, any other samples of oral hygiene aids they might need, a reach flosser, floss aids, proxy brush, whatever they might request that we have available. And then maybe the patient needs a refill on their whitening. We have a whitening reward program. Get them the refills that they need to receive. These are received for patients as long as they are on a continued recall system and remain to be stable on that continued recall system. The doctor presents and is ready for the exam. Be prepared for your doctor to come in. Have those radiographs on display, intraoral pictures you have on display and taken. Voice the areas of concern to your doctor. You can have them all written down on a sticky note before they come in or whatever works for you, and have the instruments accessible to the doctor. It is very important to find out what your doctor likes you to have ready, as each doctor is different. Know what they like to have it ready for them. Again, being prepared makes everything go more smoothly. After the exam's done, apply the fluoride application if the patient has gave you consent. We offer fluoride treatments at all cleaning appointments, so the adult and child prophys, the periodontal maintenance. We're going to focus with the patient on the cavity fighting benefits of fluoride, and we're going to have already discussed the cost of fluoride treatment and insurance coverage. We then formulate a treatment plan based on the doctor's diagnosis. We discuss the treatment plan. We get a patient signature and scan a copy into the patient document center. We show any other American Dental Association videos that we might need to, we know that would benefit them. We schedule treatment accordingly, schedule while you have them there. And if a parent or guardian isn't present with a child that presents, maybe a 14-year-old that can drive, make sure to follow up with that parent, whether it's leaving them a voicemail, letting them know to contact you in regard to their child's appointment. Let them know that you have seen their child and here's what needs to be done. Our goal is for our patients to leave with no questions and feeling comfortable with their appointment. We then check our patients out. We want to collect any patient portion due at the time of service. That is why we discuss all fees prior and receive consent so they know what is expected of them today, because it is due at the time of service. We provide them with a receipt and walkout statement, and we also give the patient an appointment card for scheduled recall or treatment needed. We thank the patient for coming, and we distribute our Share Smile. The Share Smile are postcards that are used for internal marketing. Any patient they refer to us will get a free exam and x-rays on their first visit, and in turn, the referee will get a $20 credit on their account as a thank you from us. At the conclusion of the appointment, our goal is for our patients to leave without any questions. We want our patients to leave comfortable and understanding what we provided and presented them with during their appointment. We are all about no surprises. Do the best you can do for the patient, thank the patient, and let them know we are looking forward to seeing you again.